Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
All right. Hello, this is Tim Fergestad. Thank you for joining us. I'm very pleased to have Nathan Hill with me here today. Nate is the CEO and co-founder of Strive Pharmacy, a compounding pharmacy started in 2018 here in Gilbert, Arizona, currently with 8 locations throughout the U.S., doing multiple 9 figures in revenue and has over 700 employees. They focus on personalized medicine, anti-aging, hormone replacement therapy, weight loss, etc. Great stuff. Welcome to the show, Nate.
Thank you for having me, Tim. Yeah, excited to chat with you.
All right. So is your focus always been in pharmacy, or did you do something before you got into peddling drugs?
Yeah, no, I haven't always been a drug dealer. Definitely there was a course that led me into this industry, but kind of started out through college. I went to the University of Utah, and as you know, many people that have ties to Utah know that there's a lot of door-to-door sales companies. And so I got pulled into that, did that throughout college. And then a couple of years after I graduated, I got a business administration degree from the University of Utah, and kind of got to a point where I wanted to, go into I guess more what I thought would be like a career sales role. And just through conversations, had an interest in pharmaceutical industry. And so I ended up pursuing that, looking for opportunities in the pharmaceutical industry for sales.
Okay. How was your experience at the University of Utah?
It was good. I mean, it's a lot of people label it as like a commuter school. I lived in Farmington, Utah, like 20 minutes away, north. Right. And so I would just drive up there and I'd go to my classes and come back home and work. And so I was just trying to get my degree done as quick as possible. Had an emphasis in the finance area. Thought that's kind of the direction that I wanted to go, is towards finance, but didn't really go. I mean, as an entrepreneur, you kind of go in all different directions. And so I'm glad that I took an emphasis in that and learned a little bit extra. But yeah, it was a good experience there. So yeah.
Okay, excellent, very cool. I was there about a year ago with my son to tour the campus, right? Because he looking as an incoming potential student. It has grown a lot. That place is, ever since the Olympics, right? Just they've been building and building. I was really impressed.
I haven't been up there for a while, but just throughout my time there, like it just seemed like there was a new building popping up,
right,
every quarter. So I'm sure it looks a lot different than the last time I was up there.
Yeah, that's right. I went to graduate school there, and I really enjoyed it. I met one of my investors now. I met there originally, and then he just sold his vitamin supplement company in Centerville.
Okay.
There as well. So
right next to where I grew up in Farmington. Right. So yeah, that's cool. Where my wife's from, is Centerville. So shout out to Centerville and Farmington.
Nice. Okay.
So I did that role. I actually took an opportunity in Gilbert Mesa, Arizona, for a company called Daiichi Sankyo. So Japanese pharmaceutical company. And this area we had interest in the Phoenix in the East Valley area, because we had a few friends that lived down here. One of them being my current business partner, who I grew up with in Farmington, met each other in middle school. His name's Mike Walker, and he had moved down here to do pharmacy school at Midwestern. Probably, I don't know, say like maybe 6 years, prior to me moving down here in 2016. And so when I moved here and took that role doing pharmaceutical sales, like we connected. We had been, we grew up through high school together. We went to one semester at Utah Valley University, and we were roommates together for one semester. Ran out of money, had to move back home, went up to the U, that whole thing. So when I moved down here and took that new role doing pharmaceutical sales, Mike and I had always talked about starting a business prior. We had stayed in touch. He reached out to me when he was doing rotations for pharmacy school and mentioned compound pharmacies. I had no idea what they were. Right. He just mentioned how he's like, oh, it's just, you're custom making medications. It's just a lot of cash pay. It's not, not dealing with insurance all the time. And so there was, I think during that time, it may have been during like the pain cream wave that a lot of compound pharmacies were doing. A lot of compound pharmacies got in trouble with that, with some, potential insurance fraud there. Anyway, so there was that whole situation, but he was really interested in like the personal side, hormone replacement therapy and how you can make these custom medications. And so anyway, so when I moved down here, we just decided, we're like, hey, let's meet every Thursday. Let's think of some like side hustle that we can do, even though I had just started a new role in pharmaceutical sales. And I was like, yeah, I mean, I think doing the door-to-door sales thing, it kind of like shifted my mentality to like this eat what you kill mentality, to where, whatever effort you put in, you're going to, be rewarded accordingly. And so, but yeah, just, always had this mindset of like never settling and just looking for new opportunities. And so, I think, someone who looks at trying to start a business, like just coming up with an idea is like one of the hardest things to like, because like, if you're going to come up with an idea, then at some point you've got to go all in on that idea and really test it to see if has an opportunity to scale. And so Mike, that he had been hired as a pharmacist to help start a compound pharmacy in Gilbert. And they were a hybrid where they did
insurance,
retail medications. Cash. Yeah, they did insurance. And then they just they had a small lab where they compounded some medications. And so, but yeah, he was hired on as the pharmacist. So he kind of saw how it started, but then also saw a lot of opportunities that they were missing, that there wasn't someone reaching out to the clinics and educating the doctors on the different medications that they could be prescribing. And then I was, being trained and going around to doctors' offices, detailing them on the certain medications that I carried as a pharmaceutical sales rep. And so understanding the inner workings of offices and how, the certain people that you need to talk to within the office, not just the provider, but the medical assistants, the office managers, the front desk, the gatekeepers, right? That you got to get through.
Did your skills complement his pretty well then, as from more of a business sales side versus a scientific pharmaceutical side?
Yeah. I mean, I consider myself more of a extrovert. I'm kind of like introverted, extroverted. Like when I start talking, then I can't stop talking, but it's just that initial like approach, like whether someone comes up to me, then I, have no problem having conversations and getting into the weeds and everything. But, him being a pharmacist, his family, dad was an entrepreneur. So he's very entrepreneurial minded and looked for opportunities. I don't think he ever saw himself, as he went to pharmacy school, as just being a pharmacist in a retail pharmacy the rest of his career. Like, I think he recognized that he wanted to start something on his own. And so yeah, like our personalities are very different. It's been a pretty healthy business relationship. I know a lot of people, they tend to discourage people from going into business with their friends. But it's worked out for us. It doesn't mean that it's been like a smooth ride this whole time. We've definitely had our challenges and had wedges between us, just with different difficulties. But, the current state of, our relationship, like we've been through a lot and we've learned a lot of things along the way, to where we've had to learn to trust each other and recognize as the company gets bigger, there's people that are, they want a part of what we're doing here at Strive, and they may have different motives, but we just always have to, trust each other that we're going to protect the company and protect each other and our interest in this business and our employees. And so yeah, our personalities have meshed very well. Even though Mike is a pharmacist, he's very much a business person as well, as far as like different opportunities and medications and therapeutics and partnerships that we look at and pricing on these medications to make sure we have healthy margins. He's very much involved in a lot of that. And I'm, been heavily involved in the beginning, from the brand of the company, the image of the company, the sales organization, and how we're, driving that business forward. We make a lot of decisions together.
Okay. Can you expand a little bit more about how you, well, maybe it wasn't up front, but how you structured it so you could resolve any conflicts as they came up? right? And maybe you've implemented systems for decision making and to keep things moving forward over time. But
Yeah. Yeah, no, that's a good question. I think, early on as we were growing the company, we've had different people that have come in as consultants, or we've had a few investors, that have had experience, and so we've kind of taken some of their advice. But ultimately, Mike and I, we've had tough conversations between the two of us, and the direction that we wanted to go with the company. And um, so I don't think it was as structured in the beginning as it is now. Now we have like an executive team of 8 individuals. And I think something unique about our executive team is like Mike and I, we're never gonna, you know, ram a decision through without everyone else weighing in on different opinions on the direction, because we've built our team to where it's individuals that we trust that are going to make the decision that's best for Strive and best for our employees, and not ultimately what's best for them and whatever incentives are in place for them. And so they've proven themselves over and over again to just, focus on what's best for Strive. And so the opinions that they give on certain big high level decisions that we have to make come from a place of like, what is best for the longevity of the company and for our employees. And so when we have tough decisions to make, we'll get in a room and we'll whiteboard it. We're drawing all over the place, looking at the pros and cons. And when we make a decision, it's like, there's pretty rarely someone who's just so against whatever decision that we're going to make. It's typically everyone feels really good about the direction that
that helps.
we've decided to move forward with, and it creates just a really good environment like within our executive team. And we get feedback from employees that they recognize that as well, that we're very mindful and very calculated on how we make some of these decisions that are pretty difficult.
Right. So I imagine that starts with having a clear shared vision for the future, that everybody can kind of see what the goal is and stuff. 700 employees in 7 years is pretty impressive. Can you share a little bit about what that goal is? And it was how many? You're in like 8 states or 8 locations anyway.
Yeah, we have 8 locations, but we're licensed in all 50 states. So we ship
Okay.
medications just, based off of our different
Oh,
locations. They all have to be licensed in the states that they're shipping
right.
to with the state boards of pharmacy. So, 8 locations, about 750 plus employees at this point, and growing rapidly still. But headquarters is here in Arizona. We're looking to build a new facility that's kind of in that southeast area of Mesa, near the Gateway Mesa Airport, just a bigger facility for us to continue to expand here. Here in Arizona, we've got 250 plus employees, 250, 300 employees here locally, though. So anyway, your question though is just kind of the vision and the future. Is that where
Yeah. How
you're?
many locations do you need? Is your business plan mostly
Yeah.
mail order now? And what's
Yeah,
the,
no, most of our medications we ship out. I would say across the company, it's probably about 90% of our medications just get
okay.
shipped out. But we do have like storefront. So especially here in the Gilbert location, probably out of all of our locations, gets the most like walk-ins, people picking up their prescriptions. And so
Right.
um, we always want to, have the ability to have a storefront and people come and see what we're doing and be transparent about medications, because we make medications in the pharmacies, and, anyone's welcome to come do a tour of the facility and see how we make them and all of that. So as far as like our, the future of Strive, like we've done, initially our first, we started our first pharmacy. And then as we expanded, we took on some investors, friends and family, putting kind of through our network. People did smaller investments to kind of get those ones off the ground. And then, the next 3 or 4, we ended up doing acquisitions where
Okay.
either took on smaller amount of investment or we just self-funded it, the more recent ones that
Right.
we've been able to do. So kind of where we're at now, we're what's considered a 503A pharmacy. That's kind of the classification that we are, which ultimately just means that every prescription that goes out the door and is dispensed has to have a patient's name tied to that prescription and that medication, which makes
Okay.
sense. That's kind of how most people see it. But there is, there's a classification called a 503B pharmacy, which is like an outsourcing facility, or they can make medications in bulk and do larger
More
batches.
business
And
to
then,
business
yeah,
type.
more business to business. They're supplying to hospitals, wholesalers, other 503A or retail pharmacies. They can supply them.
Okay.
So that's a different classification. And so that kind of, it limits us to a certain extent. Like we work with a lot of brick and mortar clinics that, they'll prescribe medications to Strive, and then either their patients have to pick up or we have to ship it to the patient or to an address that they choose. But these clinics that we work with, they also order different products, whether it's vitamins, nootropics, um, testosterone, different things like that they can order and then dispense out of their office. And so
Right.
there's certain business that we just can't, we can't facilitate. And so I think one of the goals of Strive is to have a 503, I know it's one of our goals to have a 503B pharmacy in our network of pharmacies so that we can fulfill from that side of things as well. So
Okay.
yeah.
Are you what's your growth rate been, and are you trying to keep with it? Because it's very impressive.
Yeah, no, it's hard. It's hard to keep up with the growth rate. And so, I mean, a lot of it's attributed to these GLP-1 medications. So when we were
Oh, really?
founded, we were starting out doing, which we still do. We do hormone replacement therapy. You have an individual who goes to their provider, they do their blood work, get a blood panel. It kind of states how much, what their levels are at, and then they're prescribed the medication specifically for where their levels are at on like hormone replacement, and also like dermatology medications, thyroid, do some different peptides as well that are FDA approved. So those are kind of been the focus of Strive from day one. It's around like functional medicine, anti-aging, and we
Right.
still like that's a huge part of what our business does. And then this peptide, GLP-1s, semaglutide, tirzepatide, they came around this whole drug shortage situation that a lot of
Right.
people have
Right.
heard of. So we've been very much involved in that from the beginning when it went on to shortage, and that's attributed to a lot of the growth of Strive, but it's also given us a lot of the resources to scale and build out different departments and ultimately like create a company that does have a mission, does have a purpose around um, providing a more personalized approach to patients' medications. I think a lot of people know that um, when you go and get a prescription, a lot of times that's not covered by the insurance company that
Right.
the doctor prescribes you. So ultimately, what the doctor wants you to be on isn't ultimately what the insurance company or the PBMs want you to be on. They want you to try other things first, right? And so,
Yep.
so a lot of people are being directed towards taking medications that are just based off of what their insurance covers. And
Right.
so at Strive
Exactly.
Pharmacy, we don't take insurance. It's all cash pay, and so it's basically a consult with you and the doctor, and that doctor says these are the specific medications we want you to take, and that's what we make up. It's specifically for that patient and what their needs are.
Right. That's a common theme or a struggle you hear about in modern healthcare. And my last podcast interview was with the owner of a PT and wellness clinic, and so many of the people hear the line from their physician or primary goes, "Well, this is the ideal treatment for you, but your insurance doesn't cover it."
Yeah,
And so trying to find a way to get them what they need. And that landscape is changing every day. We're kind of almost in a bit of a renaissance of biomedical
yeah.
treatments. Is that hard to keep up with all the new peptide, and particularly with the changes in Maha or whatever is?
Yeah. Yeah. No, we're optimistic about, I was just out in DC. We had one of our partners, PCCA, Professional Compounding Centers Association. Anyway, they put on an event over in DC on Capitol Hill where we go and lobby and we meet with
Oh, great.
Congress and try to bring up important points around our industry and different bills that we're hoping to be passed and other ones that we're wanting them to be aware of that
Right.
are going to affect us negatively. And so, I believe like with the Maha movement, there's a lot of good that's coming from it and a lot of things that can benefit us. But there's just a lot. Like there's a lot around this. It's not just around like pharmaceuticals. It's also the
Right.
different things in our food and different things in our environment and in materials. Right here, I am drinking out of a plastic water bottle,
Right.
but there's all these things that that we've been exposed to, and so I think just the pharmaceutical um, industry is just one piece of that
Right.
that needs to
Right.
see change. And and here at Strive Pharmacy, we're not like against like big pharma and the medications that they're providing. There's definitely a lot of life-saving medications that they offer and that are very much needed, but there's definitely a huge inappropriate influence from big pharma and
Right.
FDA and other government agencies where
Sure.
we're not just looking at like what does the patient need. It's a lot of it ties and stems from like obviously if you follow the money, that's where it all comes from. It comes from the profits over the patients. And so
Right.
so that's an interesting dynamic that we have to deal with as a company. It's ever changing, as a pharmacy, especially as a compound pharmacy, because we're under an immense amount of scrutiny, because we're also there's stereotypes around compound pharmacies, how they're just like, there's been a lot of claims around like bootleg counterfeit
Right.
products just being
The
made out
wild
of
wild
a
west of
the
pharmaceuticals.
wild west of the pharmacy. Yeah, they've said that. And it's like we welcome anyone to come do a tour, because especially Strive, and like we understand the scrutiny that we're under, especially being like a 50 state licensed compound pharmacy. We have every board of pharmacy that is going to, if they do receive any complaint, then they're going to question what we're doing.
Sure.
And so we have to make sure that we're buttoned up. We have a fully built out compliance team, third party test all of our medications that are made. We go above and beyond state board regulations, where we're required to do potency testing once every 6 months, and we're doing it multiple times a week, with our sterile technicians that are in there making these injectable medications,
Awesome.
and we have all the data to prove that, to show that we're
Okay.
consistent with like the quality of our products. And so it's there's a lot of scrutiny, but we embrace it because we understand that's a barrier to entry, and it's also something that sets us apart. Because
Right.
if some regulators, there's something that surfaces where they're like, hey, we got to go inspect Strive Pharmacy, we're ready, at any moment, at a moment's notice, for them to come in and do an inspection, which they do. They show up without any notice, boards of pharmacy or the FDA, and they inspect our facilities, and we're prepared to do that, which we haven't always been able to say that, but we can say that we have
Right. That's
because
awesome.
of the growth that we've had and the capital that's come in, the revenue that's come in. We've been able to invest back into this business and ensure that we are protected from a compliance standpoint and
Yep.
regulatory.
Excellent.
Yeah.
That's a strong stance. Very, very, very good. Additionally, with that, the changing alternative medicine landscape, right, in the past few years, are those areas for you to branch into? Is that more stuff for you, opportunities for Strive to grow?
I'll like what specifically are you referring to? Like what types?
Peptides, for
Like
example. I don't know. There's so
peptides?
many
Yeah.
different things out there that,
Yeah, so it's just interesting around peptides. There's certain ones that are FDA approved, like Samoralin, and there's one called PT141, and then also like the GLP ones, tirzepatide and semaglutide. Like those are technically peptides that are FDA approved.
right?
But then there's ones like BPC 157 and CJC 1295, ipamorelin. Some of these are not technically FDA approved, and so there's just been this constant battle between like some of these peptides that are being put on this list, that
Mhm.
allows us to make certain medications and doesn't allow us to. And so it's just there was a time where we were making them, and then FDA was cracking down and boards of pharmacy, and
Right.
so there's some compound pharmacies that continue to make them, but we have to be in good standings with every
Sure.
state board. And so we don't compound them in our pharmacy. We do support
Okay.
them, and we support them being sourced from the right place. And so we have partners that we work with
I
that
see.
do offer
Okay.
them. So, and that's one of the things that, with RFK and the Maha movement, we know that he's very pro peptides. And so we'll see if there's any changes that allow
Okay.
people to benefit from those through a compound pharmacy to
Okay.
ensure that they're made in the right facility.
Right. So you are open to growing into these other industry, I don't know,
Yeah.
microdosing, who knows what,
Therapeutics and
but
yeah.
you are pretty conservative and you really want to make sure you stay in really good standing with all the powers
Yeah.
that be.
Yeah. No, we're, just because we see the opportunity that we have and the responsibility that we have as a leader in this, not just the compound pharmacy space, but also just in this healthcare movement, we do believe that compound pharmacies do provided, these different forms and alternative medicines that people are able to customize with their provider that you just can't get from a retail pharmacy or from big
Right.
pharma. And so we see ourselves as an important role in helping people achieve their health goals.
Yep, for sure.
And so we're very much in tune and updated on like the different rulings on different medications and things that are coming down the pipeline that we can get into. And are there certain medications that are going to be approved and be put on the list, different lists that we can start compounding. And so, yeah, we're all for, as many medications that are beneficial to individuals.
Okay.
If we can, the more that we can make, the better.
So what percentage of the pharmaceutical industry has been traditional versus is compounding now, and how is that compounding domain growing, and what's the competition like?
Yeah, no, that's a good question. I don't have it. It's interesting because, compound pharmacies, they don't really report any numbers to anyone, like retail pharmacies. So it's kind of hard to understand like what the landscape is, what how much of the market is compounded versus retail. It's a very small percentage still, but it is growing. We have like some slide presentations that we put together that kind of show the interest around compound pharmacies and just like Google search terms, and more people like right now, there's more interest around compound pharmacies than ever before. Obviously, a lot of that I think has to do with like the GLP-1 wave and how compound pharmacies have stepped in and been
Right.
able to help meet the demand during shortages and even off of shortages. Right now, it's off of shortage, but doesn't mean that anyone,
Right.
people are able to get them right now. But Strive continues to make them. We make individualized versions of these GLP-1s that have different dosings that's available instead of like what's just commercially
Is,
available.
is that a big
Because a lot of
advantage?
people, what's that?
Is that a big advantage to be able to do the GLPs, the semaglutides, whatever, to custom dose those?
Yeah, because like it came off of shortage, and there's a huge influence from big pharma to, get the FDA to pull it off of FDA shortage. But it's still like from our wholesalers, and there's videos going around online of people calling every retail pharmacy, and no one has Monjaro, Ozempic. Like it's very difficult to get all of the doses, but they're claiming that it's off of shortage and that they can meet demand, but. So that when it goes off of shortage, then a 503B pharmacy, so they're only allowed to make something if it's on shortage, and they can only make the exact copy, which is just semaglutide or tirzepatide. A 503A pharmacy, we're allowed to make something that's based off of the doctor's discretion,
Uh,
if they feel like they deem it necessary that the patient needs a more individualized or personalized medication that has different additives to kind of help reduce some of the side effects, but also if there's not the right dose
that may or may
commercially
not be
available.
exactly on the formulary
Yeah,
for
that's
their
not, it's
insurance.
an off,
Okay.
yeah, not technically off label, but like an off dose.
Okay.
That's only available commercially. And so there's a lot of people that are doing these GLP-1s, not even just for weight loss, but for like um, for anti-inflammatory, like it's helping with that. Obviously, it curbs some of the cravings, helps people just have, kind of curb some of those sugar cravings and things like that. And so people are doing it in like a micro dose and just
Hmm.
doing small amounts just to help maintain. And it's been a
Hmm.
very beneficial
Huh.
tool
Okay.
for a lot of people, not just from weight loss, but also, from just reducing how much how much cravings that they have, but also like from anti-inflammation as well. And so,
They're
but even
related,
then,
right?
it's like,
The metabolic
what's that?
syndrome, right? Is the
Yeah,
inflammatory effects of, for example, insulin
yeah,
desensitization and all those glucose spikes is incredibly inflammatory. And
yeah, yeah. So there's a lot of reasons why people are turning to these medications that have been super beneficial. And so so that's kind of where things are at. Like from a 503A compound pharmacy, we are able to, we're not making the exact copy. We're making different versions, and we have a bunch of different formulas. And that's what the law states. That's what the regulations are. And so and I don't know if you're aware of this, but like, Strive is actually being sued by Eli Lilly right now. So we have
oh,
actually a lawsuit going on right now, and they're not coming after our intellectual property. They're not saying, hey, you can't be making this because we own the patent. They're coming after us and making claims around our misleading marketing, because our
oh,
marketing states that we do personalized medicine, and that's like definition of a compound pharmacy. And so so it's just interesting. It's ultimately it's probably not what it's about. What they're trying to
right,
do is get us to stop doing the marketing. They obviously want us to stop making
right.
it,
Taking away their
because
market share. Yeah,
compound pharmacies have stepped in and been highlighted because they've been able to come in and make these medications. And so yeah, that's,
right.
another thing that we're dealing with. And they sued two pharmacies, us and one other national compound
So is
pharmacy.
that
And so
is that a backhanded compliment where congratulations, you're successful enough to be a target now?
yeah, I mean, we at first we actually it actually got released on April Fool's Day. The lawsuit,
Oh,
we woke up April Fool's Day, and there was these articles, and we're like, "Is this a joke?" And obviously, like, it's not a joke if it's on like CNBC and Reuters and all these,
right.
these these media outlets. And so we recognize, okay, this is for real. But at the same time, we were like, if Strive wasn't on there, we probably would have been like, hey, why didn't they come after us? We're doing a lot of business. And so, not that we're definitely, we'd rather not be in a lawsuit, but at
Yes.
the same time, it's like you know, we have a lot of providers. We have like 20,000 clinics that we work with that have prescribed here. And so we have communication going out on different updates around the shortages and around different things that are happening in the industry. And a lot of people look to Strive on like, hey, what's Strive going to do here? Because
Right. You're a
we
leader.
we're a leader in the space, and we work with some of the best attorneys, and we do our due diligence to make sure that whatever decision that we make we feel comfortable with, and that it's not just a shoot from the hip decision. It's like we were very calculated and very based off of laws and regulations to make sure that the decision that we're making is best for the patients, but also it's something that we can defend as a business as well.
Yeah. Yeah. And you're having an incredible impact on people's lives. You're able to help them in so many ways. It's I can't state that
Yeah,
strongly enough. Um, who is
yeah,
it? Oh,
we
is Richard? Oh, go ahead.
oh, I was just gonna say, yeah, we released a statement around, when we ended up seeing that we were being sued by Eli Lilly, and we just sent out a statement just around how we feel like this is just an attack on personalized medicine, that it's just one of these big corporations that are trying to
Trying to
bully
for
the
competition.
little
Yeah.
guy, and it's all about profits. It's not about what's best for the patient, because
Right.
ultimately they're like, we want you guys to stop doing it, but it's like you already can't meet the demand of all the patients that need it. And so the amount of support that we've received from patients and providers and clinics that we work with is overwhelming on why they need compound pharmacies, and how they've been so useful in collaborating with a plan for their patients and what's best for them to be able to um, and it's not just around GLP-1s, it's around all the other medications that we offer. And that's something that really, like, our marketing and our education that we put out isn't even about GLP-1s. That people there's a demand for it regardless, and we're helping to educate on different products that we offer around hormone replacement therapy and dermatology medications, just different things that can help people
Yeah.
look younger, feel better for a longer period of time, and some of the peptides as well. So
Yeah. Yeah. Improving the quality of life. Absolutely. So What I was going to say is, like a number of my investors, the more successful ones, have had, lawsuits. It's just the nature of being successful. And it was Richard Branson who said, I don't remember it wasn't like a quote per se, but I think at any given time he has about 100 lawsuits against him,
Yeah.
which just blew
Yeah,
my
we have one,
mind.
so that's not bad, right? So we still got a ways to go.
Right?
It's the
Wow.
biggest pharmaceutical company in the country, but it's one at a time is
They have,
okay with
yeah,
us.
they
But
have a
yeah,
couple of
100, I
legal
can't.
firms that just twiddling their thumbs and need something to do.
Yeah, yeah, they know. Yeah, if they go after successful corporations or businesses that ultimately they may just decide to settle, and you'll get something out of it. And so people, it's the system how it is. I understand that there's got to be the ability to file lawsuits because there's a lot of people doing things that whatever it is, if it's anti-competitive or infringing on patents and things like that. But it seems like our system is at a point where it's very excessive, it's very loose to where who's allowed to sue someone for something, and
Right.
they're just dragged out legal battles that ultimately the attorneys are the ones that win in the end.
Right.
So
Right. Yeah, that's civil law or case law versus civil law, right? That's
yeah,
something that I'm learning more about, the pros and cons of American legal system.
yeah. Yeah, it's a
Okay.
interesting one that we've had to navigate through, and learned a lot. It's just another thing that we're learning through the
Mhm.
process. So along with
Right.
everything else from growing this business.
Right. Okay. Well, great. So as sort of wrap up the this interview, do you have any particular exciting plans or incentives or initiatives for 2025 or the coming year or so for Strive?
Yeah, yeah, we definitely have some things in the works. Some things are a little too soon to disclose, but we definitely, we're looking to take Strive to the next level. I think that with this whole movement around personalized medicine and um, anti-aging, there's just huge opportunities. And so we're looking to really be a leader, not just in the compound pharmacy but just in healthcare in general. Think that Strive has the
Okay.
ability to be a household name, to be able to when people see it they think of like personalized healthcare. It's just interesting. I look at we're very big on our brand and our mission, and I look at like just pharmaceutical companies in general, and it's a very sterile like industry where you look at pharmaceutical commercials, or you look at different companies that are uh, you know trying to represent these medications, but it's just all about products. It's not about the lifestyle. I mean, we literally like have life-changing medications that we offer here at Strive, and we see a huge opportunity to be able to tell stories of individuals and how these medications have changed their lives. And so I think that's where Strive is going to really stand out, is just being able to be storytellers. You know, one of the things that we emphasize and have a slogan is, why settle when you can strive? And
Right.
I think that that's something that that we've embodied as we've grown this company. Like it's pretty awesome to look back and see what we've accomplished, and we could just settle and we could just be complacent with where we're at because we've done some really awesome things. But I think what's the most motivating thing is looking ahead at how much we haven't, how much there is that we've yet to accomplish, and how much opportunity there is ahead of us, and different things that we can do to help facilitate a
For
really
sure.
easy way of prescribing medications. And we work with a lot of telehealth companies, and that's a whole nother area that is just it's relatively new. And so we're a big part of helping to facilitate that, and working with some large telehealth companies that can that we're helping to facilitate. But we were built on um, partnering with these brick and mortar clinics, where people are going in and having personal consults. And so we want to continue to support those clinics the best that we can. And so,
Right.
we have a strong presence in all the areas where our pharmacies are at, but, we believe we can have a stronger presence throughout the rest of the country. And we'll be able to do that as we're, right now, like just our Gilbert location, I think we're in, maybe 12,000 square feet between all the different, if you went to where our location is off of Baseline and Cooper and Gilbert, we've had to like take over any vacant suite just to be able to scale. But now we're looking at a facility that's about 200. About signed on a facility that's about 230,000 square feet. And so like just that facility alone is going to allow us to be able to fulfill around the country and, be able to offer more medications to people that are looking for them. So, and then we have build outs going on at our, some of our other locations as well. So that's, we're going to continue to grow and look for new opportunities where we can make an impact, and, people will be able to see Strive's name more, and just, eventually in some retail pharmacies, we believe. So.
Excellent. That's awesome. Congratulations on all that, and that steady and strong growth. That's awesome.
Yeah, I don't know about steady, but it's, definitely, I mean, yeah, definitely been a hockey stick curve, but we've, I think huge thing is just, attributing that to our team. Mike and I, we say all the time that we started this company, but we didn't grow this alone. Like we've brought in some amazing people, and the Phoenix area has, birthed some amazing individuals in the pharmaceutical industry. And, we have people that come in from outside the pharmaceutical industry, but so many pharmacists that have kind of left the big box retail, corner store, drugstores, and have come over here and just, feel like they have new life, where it's something exciting. They're a part of a company that has a mission that's, obviously we got big corporation, being sued by big corporations. And so we're pushing back. We're kind of the underdog that's trying to fight back, and, trying to provide medications that are beneficial to patients. And so we allow our pharmacists to, use their creativity and their experience to be able to benefit and the company and benefit our patients. And we implement a lot of their great ideas into the company. And so it's a very collaborative environment here. And so not just from pharmacists, but technicians as well around the valley that we've been able to bring over to Strive. And so we're going to continue to grow that out here locally.
That's awesome. Good stuff. Thank you. Nathan Hill. If people would like to connect with you or learn more about Strive, what should they do?
So you can go to our website, strivepharmacy.com. About to launch our V2 website. That's going to be very intuitive and user-friendly. And so where you can look up different medications and then find a provider in the area. We'll have a list of different ones that we work with here locally, so that you can reach out to them. So there's, you first off, going to our website, you can go to our Instagram, which is just @Strive Pharmacy. Myself, Nathan Hill, just on LinkedIn. So you can connect with me there.
Excellent. All right. Thank you. Thank you, everybody, for listening and watching. Thank you very much, Nate Hill, for joining me today. We appreciate you sharing your story and your insights into success and impact in healthcare in Phoenix and nationally through Strive, where you help people not just survive, but thrive. That's awesome. Okay.
Yes. Yeah. Appreciate it.
Awesome.
Why settle when you can strive, right?
Yeah. Thank you.
All right. Well, thanks for having me, Tim. Appreciate your time.
Inspired by our guests? Visit phoenixprosperitypodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.